What's up, everyone? Dr. Andrew, founder of the Charlotte Athlete. Charlotte Athlete is a sports and performance physical therapy clinic here in Charlotte. I have with me here today Dr. Ariel. She is our pelvic health specialist. I'll let her introduce herself a little bit.
Yeah, so I'm Ariel. I am a sports manual therapy fellowship trained physical therapist. I'm also a certified athletic trainer and a CrossFit Level 2 coach. I am currently pregnant with baby girl number 2. I'm 7 months pregnant, and I had my first baby girl in September of 2021, so she's almost 2 now. But I've been doing CrossFit throughout both pregnancies, and I've had firsthand experience on like making modifications and adjustments for workouts during pregnancy, and then I've also been through the postpartum return to sport rehab process as well. I've become super passionate about helping athletes with pelvic floor dysfunction, so I've been taking courses, and like I said, I've had firsthand experience and have begun treating. Just because it's such a taboo topic, I've wanted to make people aware that you don't have to live with the symptoms that you're experiencing, and that they can be addressed at whatever point in time that you have them.
Absolutely. So let's jump right in. We're going to go through some questions that we've gotten from past clients regarding pelvic health and the pelvic floor, and also questions we've gotten just from the Charlotte community as a whole. So we'll keep things simple to start. First one we have here is just, could you help us understand what the pelvic floor is?
Yeah, so the pelvic floor is basically just a group of muscles that make up the bowl shape in your pelvis, and they're working at all points in time, but their main functions are like helping with bowel and bladder functions. So they have sphincters that help with that. They also help with support, especially of your pelvic organs, and especially if you're growing a baby, they help hold that up, and the uterus. And then they also help with stability, so they play a role with other muscles to help maintain intra-abdominal pressure.
Awesome, I love that. So next question is, what is the core and why is it important?
So the core, the pelvic floor is actually a part of the core. We refer to the core as a group of muscles that's known as the core canister. So the pelvic floor is what's on the bottom, the diaphragm is on top, and then you've got the transverse abdominis on the front, that's kind of like your abs, and then on the back you've got your paraspinals and multifidi, and all of them work together to maintain that intra-abdominal pressure.
Cool. So what are the most common dysfunctions that you treat related to the pelvic floor?
There are 4 main types. The first one is just pain in general, so whether it's SI joint pain, low back pain, hip pain, just pelvic girdle pain in general. There's leakage, whether that's bowel or bladder or even just gas. There's prolapse symptoms, that's more like the heaviness or bulging type feeling or something that's going to fall out. There's also diastasis, or hernias are kind of in that same category, and that's just a breakdown of that core system.
Gotcha. And so incontinence, I mean, that's a big one we hear quite a bit about. What is incontinence and why does it occur?
So incontinence is super common, not normal, but common, whether you've had a baby or not. And it's basically when anything is leaving your body involuntarily, again, whether that's gas, urine, or feces. The most common type that we see here, because we work with a lot of athletes, is stress urinary incontinence. And that's just when usually athletes aren't bracing or breathing correctly, and your diaphragm and your pelvic floor have to work together, and if you're not breathing or bracing correctly, then your pelvic floor is going to take too much pressure, and then that can cause leakage or even pain.
Gotcha, cool. So then the next question would be, is pelvic floor dysfunction a normal part of having babies?
It's actually not. It's so common and prevalent that people think it's normal, but it's not. It can be addressed at any point in time, whether you have a kid that's 20 years old or whether you have a newborn. Pelvic floor PT can really help with pelvic floor dysfunction.
Cool, gotcha. Kegels is always a hot topic. A lot of people have heard that word, Kegels. Should we be engaging our core and doing Kegels all day?
That's a good question that we get a lot. Your pelvic floor is working at all times, but it does that all by itself. So you shouldn't be like squeezing anything, pulling on anything, or contracting anything. Our goal is to just restore the normal automatic function of those muscles, so you don't have to think about it.
Okay, cool. Makes sense. This next question we had from a prior patient, even if I've had a baby via C-section, would I still benefit from pelvic floor physical therapy?
Yeah, so everybody would benefit from pelvic floor PT, baby or not, male or female. But yeah, the pelvic floor is getting worked on by the 9 or 10 months of carrying the baby, not just pushing out a baby vaginally. So think of the baby, it's growing from the size of a poppy seed to the size of a watermelon. So the pelvic floor just has to adapt a lot within the course of a year. And so again, anybody could benefit from pelvic floor PT.
Gotcha. So my understanding is there's kind of two different categories. There's weakness and there's tightness of the pelvic floor. The question we got is, which one do we see to be most common?
Yeah, so again, Kegels are everybody's go-to, which would be prescribed if you had a weak pelvic floor, but we actually tend to see more overactive or tense pelvic floors, especially in athletes. So giving Kegels to those types of athletes would be the last thing that you want to do. So that's why it's super important to get evaluated and know which type of pelvic floor dysfunction that you have, because just because you have leakage doesn't mean you have a weak pelvic floor. You could have a tight pelvic floor and still have leakage, and doing Kegels would just work against you. So again, evaluation is super important.
Awesome. Yeah, I mean, evaluation is number one, but are there any ways that the general population could know if they have too much tightness or tension in the pelvic floor?
Yeah, so again, being seen by a pelvic floor PT would be the number one best way to know, but there are some general trends that we do see as far as personality traits go in overactive pelvic floor. Some of those could be if you're always stressed, or you just have a go personality, if you grind or clench your teeth, if you have pain inserting a tampon or after intercourse. Those are all really common symptoms that we get, from overactive pelvic floor.
Gotcha. Makes sense. Another question we got, can hip SIJ or low back pain be coming from the pelvic floor or pelvic floor dysfunction?
Yeah, so a lot of times the pelvic floor can actually be the culprit in SI joint, hip, or even low back pain. And a lot of times we see that in lifting athletes. So again, it kind of goes back to the bracing and breathing function. Again, the diaphragm and the pelvic floor need to work together, and if they're not, and that athlete's not bracing correctly, then the pelvic floor just can't handle it, and that's when it can cause pain in those areas, or it can even cause that leakage that we talked about.
Makes sense. Cool. Two more. So the next one would be, can your pelvic floor be affected by other areas of the body, so the other way around?
Yeah, so that goes a lot into above and below basically the core. So for instance, if you have limited lat or shoulder mobility, so say you're lifting something overhead and you don't have enough mobility, you're gonna arch your back to try to get higher, and that's gonna affect that whole core canister that we talked about, and so then you won't be able to maintain that intra-abdominal pressure, and then that can lead to leakage or pain. And the same goes for hip mobility, core stability, breathing and bracing habits, and all of those play into it.
Gotcha. Last question, and we get this one quite a bit. Is the internal exam absolutely necessary?
Yeah, that's a very common question, and the answer is no, just because we've had numerous studies that have been done that have shown the effectiveness of telehealth for rehabbing the pelvic floor, and so the internal exam is just a piece of the puzzle. We tend to try to look at the full picture, which would be your breathing and bracing habits, your symptom description, your toileting behavior, stress management. All of those make up the full picture, and you don't need that just one component to make or break your diagnosis. So it's not always necessary.
Awesome, super helpful. Well, that wraps it up. Dr. Ariel, thank you so much for hanging with us today. I hope this was helpful for you guys. If you do want to learn more or get help with any of the pelvic floor dysfunctions we discussed, or and there's obviously a lot more beyond the picture too that we didn't get into, but if you'd like to learn more or get some help from Dr. Ariel or get help with your pelvic floor, she's your girl without a doubt. We're here to help. You can always inquire on our website, thecharlotteathlete.com. You can text or call us. Our number is 704-848-6466. Shoot us a text, give us a ring. We're here to help. Thank you guys so much, and we're here if you need y'all, and we'll see you guys soon. Thanks.